What's up, everyone, and welcome back to the channel. Today, we're diving into a fascinating class of drugs that are like secret agents for your blood pressure. We're talking about angiotensin II antagonists, or as I like to call them, the ultimate pressure defenders. Now, if you've been following our health videos, you might remember something called ACE inhibitors. Well, these new drugs, the angiotensin II antagonists, are like their younger, cooler siblings. They both work on this incredible system in your body called the renin-angiotensin system. It's a bit complex, but just think of it as your body's built-in blood pressure regulator. So here's the deal. In this system, there's a key player, a powerful hormone called angiotensin II. Its main job? To tighten your blood vessels, which makes your blood pressure shoot up. It's kind of like squeezing a hose. The water pressure goes way up. Angiotensin II antagonists are the heroes that swoop in and block this angiotensin II from doing its job. They essentially stop it from ever reaching its receptors. And here's the best part. The main advantage of these drugs? They don't have that super annoying side effect of a persistent dry cough that's sometimes associated with ACE inhibitors. If you've ever known someone on those, you know exactly what I'm talking about. So for a lot of people, these new generation drugs are a game changer. The most common ones you'll hear about are Losartan potassium. This is a big one, a real star in clinical practice. Candesartan, and Telmisartan. So, how exactly do they pull off this magic trick? It's a three-step process. They act on the angiotensin II receptor type 1, or AT1. Think of this as the specific lock that angiotensin II needs to open. By blocking this lock, they stop three key actions. They prevent your blood vessels from getting tight. They stop your kidneys from holding on to excess sodium. And they inhibit the release of a hormone called aldosterone, which also helps control blood pressure. The result? Your blood vessels relax, your body gets rid of excess fluid, and your blood pressure drops. It's a beautifully orchestrated domino effect. These drugs aren't just for one thing. They're used for a whole range of conditions. They're like a multi-tool for your heart and kidneys. You'll find them prescribed for hypertension, the classic high blood pressure, diabetic nephropathy, protecting the kidneys of people with diabetes, congestive heart failure, helping the heart pump more efficiently, and left ventricular hypertrophy, when the heart muscle gets too thick. Now, and this is super important, like any powerful medication, they're not for everyone. You absolutely have to listen to your doctor. These drugs are generally not recommended for peptic ulcer patients, people with hypotension, already low blood pressure, and a big one, pregnancy and lactation. If you're pregnant or breastfeeding, these are a definite no-go. And finally, a few precautions. Your doctor will be extra careful prescribing these if you have any of these conditions: active infections, asthma, or allergic disorders. A condition called renal artery stenosis, where blood flow to the kidneys is blocked. Hyperkalia, which is too much potassium in your blood, or any impaired renal, hepatic, or cardiac function. So, there you have it, a quick rundown on angiotensin II antagonists. They're a modern marvel in medicine. But remember, always consult a healthcare professional before taking any medication. All right, so we've talked about what these drugs are and how they work. But what about the potential side effects? It's a crucial part of the conversation. So let's get into the most common adverse drug reactions you might experience. Even though they're known for being a bit gentler, Angiotensin II antagonists can still have some unwanted effects. These include hypotension. This is a big one. Since they're designed to lower your blood pressure, you might feel dizzy or lightheaded, especially when standing up too quickly. Upper respiratory problems, things like a stuffy nose or a sore throat, can sometimes pop up. Back and neck pain. Some people report feeling aches and pains in these areas. Fatigue, feeling unusually tired or a lack of energy. Skin rashes, a less common side effect, but something to watch out for. Hyperkalia. Remember how we talked about these drugs affecting potassium levels? Well, they can sometimes cause your potassium to get too high, which is why your doctor might want to monitor your blood work. Taste disturbance, a change in how food tastes. Now, let's talk about how these are typically taken using our example drug, Losartan potassium. The usual dose is anywhere from 25 to 100 milligrams once a day, and it's best to take it right after a meal. And you'll find it in a very common form, a tablet, taken orally. Okay, so we've covered Losartan, but what about another one of its cousins, Telmisartan? Telmisartan is pretty interesting. Its active form is actually 10 to 40 times more potent than Losartan. Think of Losartan as a regular car and Telmisartan as a high-performance sports car. It gets the job done with a lot more power. But here's the good news. Even though it's more potent, when it comes to the nitty-gritty details, Telmisartan is very similar to Losartan. Its mechanism of action, indications, contraindications, precautions, and adverse drug reactions are all essentially the same. The only main difference is the dose. Because it's so much more powerful, you'll see a smaller dosage range for Telmisartan, typically 20 to 80 milligrams per day. Just like Losartan, it comes in a simple tablet form and is taken orally. And that wraps up our deep dive into the angiotensin II antagonists. I hope this gave you a clearer picture of how these powerful drugs work to help manage blood pressure and other conditions. As always, this is for educational purposes only, so make sure to talk to your doctor or pharmacist about any health concerns. If you learned something new, hit that like button and subscribe for more health explainers. Thanks for watching, and I'll see you in the next one.